This is Wellness Health Solutions Training. Today we're going to talk about an introduction to telemedicine. And I think one of the telemedicine is going to be the game changer. This is the most significant benefit in our entire program, and the benefit that is going to save the employer the most money. That's where you're going to get the bang for the buck. Almost all the other benefits are going to save the employee money, but telemedicine is what's going to change the whole paradigm in healthcare and help them, if they include this as part of their cost containment strategy, it's going to help them save a significant amount of money. So what we need to do is educate employers, and a little bit of it is setting the stage, some of it is telling stories. So that's how I'm going to do the training. In setting the stage, I think it's very clear to share with all of our clients that we already have a shortage of primary care physicians. With millions of more people entering the system, we're literally going to have a crisis. Something is going to have to change. There has to be innovation. A couple of things that are going to happen that we already see. It's only going to get worse. Two ends of the spectrum. One is you have a ticking time bomb. You have somebody in the company who really has some serious issues, but it's a hassle to get to a doctor. It's a struggle. It's not easy. So what happens? They ignore symptoms. They delay treatment. It leads to more serious medical complications. If they're self-insured, this could cost thousands and thousands or hundreds of thousands of dollars. If they're fully insured, it adds to their experience rate and only raises, their premium the following year. So, this is a huge problem. But on the other end of the spectrum, you have people who end up leaving work for minor issues. And I typically ask whoever it is I'm talking to, I say, let me ask you, Sally, let's just say you had a sinus infection or an allergy, and you had it the last couple years. You get it every year. You know what the problem is. You know your body. You know what you need. And you call your doctor's office, and you get the nurse on the line. And you say, nurse, this is Sally, and I had this allergy last year at the same time, and I was wondering if I could just get you to write me a prescription just like you did last year. What is she going to say? And sure enough, 9 out of 10 times the person I'm talking to says, well, she's going to tell me I have to come in and see the doctor, which is exactly what happens. Unless somebody's doctor is their best friend or a good friend, that is the scenario. And it is so terribly antiquated and inefficient. Imagine if you could actually talk to your doctor and they said, oh, this is simple. I'm going to write you a prescription. What that could do in terms of you not having to leave work and being productive. So what happens is Sally ends up leaving work, and I tell her, I go, this happens to your employees all the time. They have to leave work for a minor issue. So now you have an absent employee, a loss of productivity, unnecessary costs. The employee pays money out of pocket. The employer's paying money out of pocket, or the insurance company is, or it's contributing to the experience rate for something very, very minor. And then the other thing is, what if that happens at night or on the weekends or when somebody's on vacation? They run into an urgent care center or an ER because that's the only door that's open. And it's a terribly inefficient and expensive way for health care to be delivered. So here is what I want employers to understand is going to happen in the future, the near future. One, here is how people are going to be accessing health care. One, they're going to continue to go to their medical offices, but they're going to be overcrowded, and there's going to be a lot of, nurse practitioners and physician's assistants to try to triage patients because the doctors can't handle them all. You're going to see walk-in clinics popping up in every grocery and pharmacy, which can also help with many minor conditions. You will continue to have the overuse of urgent care and ER clinics at night and weekends when all these other places aren't open. But telemedicine is going to be the fourth access point, and it's going to be the most rapidly growing access point for healthcare in the years to come. And what telemedicine is simply is having access to doctors by phone or secure email, where they can be the navigators, the gatekeepers and navigators for healthcare and the patient advocate. Why will telemedicine take over as such a fast-growing segment? One, because you can't get in to see physicians. I mean, there's just a shortage. Two, they can provide immediate access to healthcare to every individual, wherever they are, whenever they need it. And because everybody has a phone, the most efficient and cost-effective method to deliver telemedicine is by phone. It's as simple as that. Now, a lot of people are skeptical because they haven't heard it. Anything new has a little bit of resistance. The National Center for Policy Analysis 4 years ago had a white paper, and they're like the Brookings Institute, a big think tank, very well respected in Washington, D.C., where they wrote a white paper where essentially the bottom line is they said telemedicine had the potential to restructure medical care where it can solve problems, reduce costs, and improve quality of care. And another position paper from the Center for Health Transformation said telemedicine will play an increasingly central role in getting the right care at the right time to individuals, particularly for acute, routine, episodic, self-limited, and minor illnesses. That's the key. Now, telemedicine has been around for a while, and you may have some clients that say, oh, yeah, we've heard about it, and we tried that many years ago. And if you say, well, what happened? 9 out of 10 are going to say, well, nobody really used it. Well, that's true. It was new. People didn't know what it was, and it came with a copay. So most companies paid a few dollars a month to have access, but the employees had to pay every time they called a doctor. And they were reluctant to do it because they didn't know what they were getting into. They weren't educated well. It was a brand new concept. And what if that doctor said, you got to go to another doctor? Then they have to pay twice. So there was a barrier to entry, and it didn't get used a lot. But times have changed. And part of our program is we have capitated the doctor's fees. So when our clients talk to a doctor, they don't pay a copay. It's all included. So in our telemedicine program, we are actually contracted with the top 3 telemedicine providing companies in the country: Teladoc, Consult a Doctor, 1-800-MD. We work with them interchangeably. So we work with one of these telemedicine providers, and they all provide a network of licensed, board-certified physicians who are available 24/7, 365 days a year, by phone, by secure email, and by directional video. These doctors can diagnose and treat non-emergent routine medical conditions, and they can write prescriptions when appropriate. And I'm going to show you a whole list of what kind of prescriptions they write, because they're not writing prescriptions for, DEA-controlled drugs or lifestyle drugs or cosmetic drugs. But the whole idea here is not to replace primary care physicians. The idea is to call them when your doctor's not available, or you have some non-emergent routine condition, or it's after hours, nights, weekends, or you're out in the field or on vacation, or you need a refill of your simvastatin. In the past year, in the surveys we have done with our clients, with our telemedicine firms and their clients, we have discovered that 94% of the calls that come in are successfully treated and diagnosed. Only 6% are told they can't be treated by phone and they need to get to a clinic. And we've got 98% satisfaction rating. We've also found through surveys that 64% of those who called said they would have gone to a physician. 15% would have gone to an ER. So if you start to do the math, the time and the money that's related to these numbers, it's really staggering. I mean, if a company realizes that they can cut office visits by 64% and ER visits by 15% and keep people at work, the numbers are truly staggering. So who are these doctors? For anybody who's a skeptic, it's just like you're a doctor. They're experienced in primary care, internal medicine, or emergency room practices. A lot of them are just like our doctors who just want to work a little bit extra, so they're on call when they're at home. They're fully credentialed by the same organization that credentials doctors to work in hospitals. And here's the conditions they treat. If you look at this list, colds, flu, sore throat, bronchitis, allergies, respiratory infection, this list in front of you represents 80% of all the claims that come in on a daily basis. This is what your doctor's doing 80% of his day. And everything here pretty much has classical symptoms that are easy to diagnose and treat. It's as simple as that. If it's something much more complicated, high fevers and rashes, they're not doing it by phone. The scope of their service is actually pretty limited. It's all evidence-based. They will refer a patient to a physician when the symptoms exceed their scope of services, and they keep all electronic health records so they can communicate that to other physicians. And this is a list of the types of medications that are prescribed. You know, this is what doctors prescribe 80% of the day, every day, mostly, you know, for allergies, for infections, and things like that. So bottom line on telemedicine is, this is, like I said at the beginning, this is what's going to save the employer the most amount of money. All I can say is you can't promise somebody a return on investment because it depends on, you know, what package did they buy, what did they pay for it, how many people are calling the doctor first. What I have found is if a company gets a package of benefits, and if they can get as few as 25% of their employees to begin to call the doctor before they go run to a doctor or an ER, company's going to get a 2-to-1 return on investment or more. Over the next couple of years, as they truly ingrain their employees or require their employees to call first, as they strongly encourage it, they can start to see 3, 4, 5 times return on investment. So telemedicine truly is the game changer in healthcare, and this is what will save the employer a lot of money. It's a low-risk investment with a very high potential return.